Hello everyone, today we are here to present our project, Impact of Palliative Care Service Administration on the Lives of Terminally Ill in Telangana, a case study of Sparsh Hospice of Hyderabad. Let's introduce ourselves. We are from the Govt.city College, Nayapur, Hyderabad. Myself, Gautam, and my teammates are Asma, Chakravarti, Mahesh, and Varshita. Let's start our topic with the golden words of Mother Teresa. Helping hands are better than the praying lips. First Hospice of Hyderabad providing quality treatment without any fee for the terminal disease such as advanced cancer and the heart disease. Now let's understand what is palliative care. In simple words, we can define it as the touch of love. WHO also assumes that it provides quality of life. As we went to the Sparsh Hospice of Hyderabad, we interacted with the respondent. This expressed gratitude. One of the respondents expressed that initially they went to the corporate hospital even though they spent 8 lakh rupees for the treatment of cancer, but not satisfied with their treatment. Later they realized that it is more worthy than the corporate hospital. As we understood that it works as the toss barrier to the terminal ill patients. The majority of beneficiaries are the women, were mostly getting treatment for the breast cancer. 80% beneficiaries are socially and economically downtrodden peoples. It is achieving sustainable development, 3 goals of UN. It has created impact on 11,688 terminal people since 2011. Once Swami Vivekananda said that service to man is service to God. We are intended to promote this novel concept among the needy peoples in the society. Next part will continue by my team.
Objectives of the study: to investigate the impact of palliative care services on the quality of life of terminally ill patients in Telangana, to examine the administration role in treatment decision and care coordination, to examine the role of Seva kitchens in providing high quality liquid food, to examine the application of inpatient and outpatient services to terminally ill patients to manage pain and their symptoms, to study the provision of free pediatric care services among the children to improve pain and quality of their life, to study the impact of free distribution of medicines and dry ration among the bereaved families and below poverty line families, to examine the home care services provided for terminally ill individuals to manage pain and symptoms, even to heal their wounds, to explore the uses and strategies of palliative care services and related needs, to evaluate the impact of palliative care services of outreach programs on community awareness and knowledge. Next part will be continued by my friend.
Statement of the problem. The demand of palliative care is rising globally due to the aging population and growth of non-communicable diseases. In India, less than 1% of population has access to such services, showcasing a significant healthcare gap. It ranked 67 out of 80 countries globally in low quality of death, and coming to Telangana, 70% of cancer cases are detected at the terminal stages, increasing burden on the palliative care. Against to the background, this study project focused on the role of palliative care services at Sparsh Hospice, Hyderabad, and aiming to guide the policymakers and healthcare administrators. Research methodology. To achieve the purpose of the project, this study focused on both qualitative and quantitative method. Keeping in the view, we conducted research at Sparsh Hospice, Hyderabad, and collected a sample of responses from 360 respondents of 9 wards utilizing both primary and secondary sources. The primary data was collected by conducting field interviews, observational method, focus group discussion with structured questionnaire, and secondary data was collected from the Sparsh Hospice activities, record maintenance, publications, pamphlets, and with the tools of audio records and telephonic conversations, etc. Next part will continue by my teammate.
Analysis of the data. Details of year-wise beneficiary in number 2000 level to 2024. Details of beneficiaries level 1688 since 2000 level of the patients. Major finding. It is clear evidence that our study, the palliative care service of Sparsh Hospice not only create impact in Telangana but also in worldwide like Australia, America, etc. It was found for the respondent have expressed excellent satisfaction in 95% and very good in 5%. We found for the Seva kitchen has been providing rations and liquid food to the patients, not only in patients and one caregiver of their family members. And it was found for the more than 11,688 benefits and 20,500 are benefits in home care services. And it was found for the 80% of the cases of cancer prevailing and 70% of the breast cancer of these patients. Among them, the 65 years are around the 50% and 38 to 54 are in the 38% and 15 to 24 in the 12%. And when we comparing the last year, the cases are increased in 12%, home care cases are increased in the 17.7%. And we found from the many students and the professionals are doing the internship programs and the certificate courses in the Sparsh Hospice outreach of the community of the program. And we found the sustainable development goals. The 3 is the status of health and well-being, 10 is the reduce inequalities, 17 is the partnership of the goals.
Conclusion and the suggestions. Awareness should be created among both health workers and in the community that limits timely identification and referral of patients requiring palliative care. Palliative care should be included within countries' plans and budgets. Palliative care needs to be provided in accordance with the principles of universal health coverage. We recommend policymakers to run help desks at all the government hospitals to create awareness about the Sparsh Hospice. We suggest a small subject to be included within the curriculum of MBBS. We encourage NGOs to establish palliative centers and highlight community-driven initiatives. Promote volunteerism as a tool to increase access to palliative care. Promote Kerala's community-driven palliative model. Palliative Day has to be celebrated in every schools and colleges to create awareness about the palliative services. A healthy lifestyle can help you to reduce the risk of falling under chronic diseases. Conclusion. The service and commitment of Sparsh Hospice shows that humanity still exists in the materialized modern world. Sparsh Hospice not only adding life to the patients but also touches the love in the form of humanity to serve terminally ill patients in the society. Every soul must go one day, but that departure must be a dignified one. We appreciate, applaud, bow our head to the staff of Sparsh Hospice for their service. So therefore, we need to promote the noble cause of Sparsh Hospice for the well-being of the society. We pledge to uphold compassion, dignity and care for the terminally ill by joining hands and promoting the noble cause of palliative care service to reach the unreached corners of the society. Thank you.